Hello and welcome. Today, we are diving right into something that's so important for every parent, your child's dental health. Let's get started on this parent's guide to your child's smile. It's a question pretty much every parent thinks at some point. They're just baby teeth, right? They're gonna fall out anyway, so do they really matter all that much? Well, the answer is they matter a whole lot more than you might think. Honestly, they're not just temporary placeholders, they're the absolute foundation for a lifetime of good oral health. So, let's start right there with the why. Why is it so incredibly important to look after that very first set of teeth? Okay, so baby teeth are actually doing a ton of work. Of course, they help your little one eat properly, but they're also crucial for learning to speak clearly. And here's the big one. They are perfect little space holders, saving a spot for the adult teeth to come in correctly. If one is lost too soon, it can cause a bit of a traffic jam down the line, leading to crowding. So with that in mind, let's rewind all the way to the beginning. We're talking about those first few years, that journey from gums to those first adorable grins. This is pretty amazing when you think about it. At birth, your baby has a full set of 20 teeth just waiting under the gums. Then, somewhere between 6 and 10 months, the first ones, usually the bottom two in front, make their grand entrance. By the time they hit 3, most kids have their complete set. The second you see that first little tooth, it's game on. Time to start brushing. A great way to do it is to have your baby lie down with their head in your lap so they feel safe and secure. Then just gently lift their lip and use a super soft infant brush or even a damp cloth in little circles. It's all about making it a normal, gentle part of the day, right from the start. And what should you use? Well, keep it simple. Until they're about 18 months old, all you need is that soft brush and a little bit of water. And listen, a quick word on teething. I know it can be tough, but it's best to avoid teething gels because of potential side effects. A chilled teething ring is a much safer bet. This is also the perfect time for their first visit to the dentist. Taking them around their first birthday isn't about looking for problems. It's about getting them comfortable and starting a positive, fear-free relationship with dental care for life. All right, those first teeth are in. Now we're heading into a really important phase, the years where we build the habits that are going to stick for life. So, once your little one hits the 18-month mark, it's time to graduate from just water. You can now add a tiny, and I mean tiny, pea-sized amount of a low-fluoride children's toothpaste to the brush. And here's the next big question I get from parents all the time. Okay, we've got the brushing down, but when on earth do we need to start thinking about flossing? The answer is actually really simple. As soon as you see any two teeth that are touching, that are snug up against each other, that's your cue. It's time to start flossing in between them. Of course, diet plays a huge role here. And it's not just about candy and soft drinks. You've got to watch out for those sticky, sugary snacks that seem healthy, like muesli bars or fruit roll-ups. They can really cling to teeth. Your best bet is always whole foods, things like fresh fruit, veggie sticks, and cheese. So, what's the magic number? At what age can you finally let them take over the brushing and flossing completely? Well, it's around age 8 or 9. Before then, their little hands just don't have the fine motor skills to do a really thorough job, so they definitely still need your help. Next up, let's talk about that exciting and sometimes a little weird milestone, the wobbly teeth phase and the arrival of the permanent teeth. This all kicks off around age 6. And fun fact, the first adult molars usually sneak in at the very back before any baby teeth are even lost. Then, by about 13, the whole transition is pretty much done. Now, see that window between 7 and 10? That is the absolute sweet spot for a first orthodontic checkup. And that's not just some casual advice. It's a direct recommendation from the Australian Society of Orthodontists. Why so early? Well, an early check lets them see how the jaw is growing and spot any potential issues with crowding way ahead of time, which can make treatment much simpler later on. Okay, knowledge is power. But now let's get into the really practical stuff. How do you actually access all this dental care for your child here in Australia? You've basically got 3 main routes. There are public dental clinics, there are private dental practices, and in some states, you can even take advantage of school dental services, which can be super convenient. Okay, take a look at this number. For a lot of families, this figure is a real game changer. It can make all the difference in being able to afford regular dental care. So what is it? It's the Child Dental Benefit Schedule, or CDBS for short. It's a government program that gives eligible kids up to $1,095 over 2 years for basic dental services. We're talking checkups, cleanings, fillings, the works. And here's the really great news. So many dentists who specialize in treating kids can bulk bill directly for the CDBS. That means there might be no out-of-pocket costs for you at all. It is absolutely worth checking to see if your child is eligible. So, we've covered a lot, from that very first tooth all the way to getting financial help. But it really all boils down to this. What is the one simple habit, the one small change you can start today to help protect that amazing smile for a lifetime?